Hello, welcome to the RCSI My Health Lecture Series. Tonight we're going to be looking at stress management, mindfulness and relaxation. This is the last in the lecture series for the year 2020, and over the next couple of weeks we'll be launching the series for 2021. This lecture, as with the previous two lectures, is associated with the RCSI Centre for Positive Psychology and Health. The mission of the centre is to improve health and well-being for the largest number of people possible. It's my great pleasure once again to introduce our chair for the evening, who really needs no introduction, Dr. Ciara Kelly.
Thank you very much. I'm delighted to be here at the RCSI this evening. As you have heard from Ciara, this is part of the Positive Health series of lectures, the third and final one this year. And tonight we are talking about stress management, we're talking about mindfulness, and we're talking about relaxation. Very prescient, I think, at the moment. Obviously, we are living in the time of Corona. Certainly when we started this series, we had no notion that we were going to go into a pandemic, and the kinds of stress that people would be experiencing would become literally extraordinary. We are in a once-in-a-century event, and I suppose the two things that stress people greatly is worries about their health and their loved ones' health, and indeed worries about their finances. And as it happens, both health and finance are things that people tend to worry about more than anything else. So this is a particularly stressful time. I often think that the best and simplest way of explaining what stress might be is the difference between what you believe is expected of you and what you feel able for, and the shortfall between those two, therein lies stress. And we all experience at times, but now is a particularly different time. And I think it is wonderful that we're doing this lecture currently, because I have no doubt many of you out there are experiencing great deals of stress at the moment. First up to the podium, though, who's going to speak to you now, is Dr. Frank Doyle. Frank will be talking about what science tells us about managing the symptoms of stress, anxiety and depression. And I'm going to hand over the reins to him right now. Thank you.
Thank you very much, Ciara, for that introduction. So yes, I'm going to talk about the science underpinning managing symptoms of stress, anxiety and depression. What I'm going to do is focus on four main areas. First of all, I'm going to talk about stress and news stories in the media that you might come across. And I'm going to take a scientist's view of these media stories to see what is the science underpinning these, essentially. And then to do that, I'm going to have to explain a little bit about randomized trials and the value of cumulative science, why we shouldn't necessarily just believe one story. Maybe we have to look at this a little bit more and over time. I'm also going to talk about how you might want to find out more for yourself if you're interested in these areas. What could you do about this? Finally, I want to end up making the point that if something's good for you, then it's good to keep doing that. We don't necessarily have to look for science for those answers. So as Ciara has said already, we're in a stressful world. So here are some just some headlines I've picked up off the internet. We have the obvious stressors around COVID. Ciara has mentioned already economic stress. We had this a story from last year actually talking about a six-fold increase in economic stress as a result of the previous recession. We're obviously moving into another recession now or in the future, so this is going to be stressful for people. We have stress in work mentioned. And my own personal favourite is how to cope with toxic family members during Christmas. And as I began to think about that, I thought for a second that maybe I'm the toxic family member, but that is a whole other different talk. So I'm going to skip that one. Before I get into this, I just want you to think for a second about what you actually use for stress management yourself. And then think about, why do you do that? Where did you hear about this in the first place? Is this something you picked up off friends or family? Is this something that somebody told you or advised you to do? Or is it just something that you started doing yourself? Because if you're like me, you might pick up a lot of your news from the media. So what I want to do here is take a look at some stress stories and look at the underpinning science and ask, how did the journalists come to the conclusions that they're writing about? So I found this one. I thought this was a really interesting news story. It's a natural way to end stress in the office. So what this story is telling us is that if we hang pictures of landscapes and nice art in offices, people will become less stressed. And it's from researchers in the University of South Australia. And what they've done is, here's an example of a landscape. They have it in an office. And what they did was they tracked 91 people in various work sites, and they measured psychological well-being and stress. And they said stress reduced by 40% over time. And this sounds fantastic. If this is true, then lots of businesses could invest in art, hang it on the walls, and expect a 40% stress reduction. So researcher Dr. Bridget Minuzzo is involved. So what I did as a scientist, I went to this website called Google Scholar. So Google Scholar is basically Google for scientists. So if you want to look at underpinning science, you can go there. And I typed in Bridget Minuzzo, and I found 4 results. And these are the 4 results, as you can see here. And unfortunately, none of these address hanging landscapes in offices and reducing stress. So this is suggesting to me that this news article is based on what we call a non-peer-reviewed published article. In other words, it's not published. So the value of peer review, as you might be hearing a lot during this time of COVID, is that it gives other scientists a chance to check to see if the results are true or verifiable or whatever. So this is not a peer-reviewed story. So as a scientist then, I would conclude that this is not a published study, and therefore we probably shouldn't believe it. And another reason I might not believe it is because it doesn't have a randomized trial in the story anywhere. And randomized trials are very important, and I'll come back to that in a second. So in essence, we shouldn't believe just this one-off story that appears on its own. Now, why randomized trials? Randomized trials are the gold standard, the only true design that can establish whether a treatment is effective or not. So if scientists want to find out if a new antihypertensive drug works, or if a new drug lowers cholesterol, or a new drug treats depression, they'll do a randomized trial. And we can do the same thing for stress and stress management. We can engage in randomized trials. What randomized trials involve is at least 2 groups of people. One group gets the intervention, that could be a stress intervention, and the other group does not. And the reason why that's so important is if we take an example, let's say RCSI here, let's say we believe that news story and we wanted to hang landscapes up in every office. We could measure stress before and after, and we might find a 40% reduction in stress in workers and students. But actually, maybe that was just around exam time. Maybe it was around Christmas time. So we can attribute the reduction in stress to the fact that the exams are over, or maybe towards the end of the financial year, or some other stressful periods in work. Maybe in a hospital setting, you might have something like the winter vomiting bug ending, or maybe the pandemic ending, or whatever it is. That's wishful thinking there, I think. But what randomized trials allow us to do is attribute they allow us to attribute any reduction to the intervention itself. And that's what randomization does. It makes both groups equivalent in every other way, apart from they receive the intervention or they don't. And that's the true power of randomized trials. So only with a randomized trial design can we truly say if a stress intervention works or not. And you might say, well, that's all very well, but scientists find weird contradictory results all the time. They're always contradicting each other. And I can't deny this. Scientists do find weird contradictory results. Here are just some examples I have on the slide. The cancer risk is higher for women in one story, and then men twice as likely to die from cancer than women in the other one. Red wine and dark chocolate kills cancer. It was a cancer treatment according to one story, and then later on, why cancer patients should avoid chocolate. So with these types of stories, it's no wonder that people can be confused about what you should believe, and maybe we should disregard science completely. And I'm here to say that no, we don't disregard science. We look at the science underpinning the stories, and then we make a judgment. And the reason we end up with so many contradictory results is because science is really, really difficult. It's really, really difficult to get it right. There are hundreds of ways a scientific project can break down. And this explains why results can be contradictory. So what we do instead in science, we rely on replication. Because if I conduct a study and find a new stress management technique, and somebody else checks that and finds that it works, and somebody else checks that as well and they find it works, then 3 times over, we're pretty confident that this works in general. When we have 2 or more studies to look at, we can actually average the results of all of those studies, and we call this a meta-analysis. And meta-analysis provides fantastic evidence about whether a treatment works or not, because really science is a cumulative process. You can have strange findings or outliers when you run studies, but over time, if you run enough studies, you'll know for sure if they're true or not. So, back to the question, what does science actually tell us about stress, distress, depression management, and so on? So what I want to do is look now at meta-analyses or systematic reviews of the evidence of these questions. So, first one is, what about exposure to art? So, there isn't any, I couldn't find any recent review of this area that was a systematic review or a meta-analysis, but I did find this one from the Journal of the Royal Society for the Promotion of Health. And in that article, once I read through it, they stated that there were no randomized trials whatsoever. So, what do I conclude from this as a scientist? I cannot conclude that art or exposure to art and landscapes in offices reduces stress. I'm not saying it doesn't, but I'm saying that we're not conclusively there yet. So somebody could do studies to find that out, but we're not sure. Later studies might find it to be true, but at the moment we cannot say that. So then I found some other interesting stories in the media about how we could manage stress. I was really taken by this one. Could a bed of nails really save you from festive stress? This is getting back to my Christmas theme, maybe where I'm the toxic individual, I don't know. But essentially, this is the bed of nails. It's about 2 feet long. There's 6,000 plastic spikes. Somebody says this equates really to either acupressure or massage. So great, as a scientist, I can go and check out what is the scientific basis for acupressure and massage. So here is a review. I found the evidence for shiatsu, a systematic review of shiatsu and acupressure. And what the authors conclude here is really that there's variable or poor quality evidence for stress and anxiety for these treatments. So at the moment, again, I don't think I can conclude that shiatsu or acupressure are good for managing stress. What about massage? Well, this was a nice meta-analysis of studies looking at massage post-operatively. And there's about 8 studies here. I don't want to get into the detail of the slide, but there's about 8 studies. And this slide shows us why some studies find effects and some studies don't. The black line down the middle with the 0 on it is what we call the line of no effect. And if any one of those studies touches that line, it means there was no differences between the groups. So you can see that 2 or 3 of those studies are not only touching the line, but they're going through the line, which is telling us that when they did this randomized trial, they found no effect for massage. But on average, over the 8 trials, there is a significant effect of massage. So this is a perfect illustration of why science is imperfect. Sometimes it goes wrong. But on average, meta-analysis will tell us what's true and what's not. So massage, yes, it does benefit anxiety post-operatively. Now, you might be a person who, anytime you bring up a topic, somebody tells you there's an app for that. And an app seems to be the solution for everything nowadays. I say, okay, let's ask the question, are they effective for stress management, depression, anxiety, and so on? And this is a meta-analysis of 19 different trials, and they found, yes, apps could help with depression, but there was no effect for anxiety or suicidal ideation or things like that, or self-injury. So the authors, again, they're being cautious, and they're concluding that although there's potential there, we can't use them as standalone interventions. So by all means use them, and if they're recommended and help and used in conjunction with clinicians, fantastic, but as standalone therapies, they're not ready to be just recommended as they are quite yet. Let's move on to depression, because a lot of people will be interested in this. So the main treatments for depression, if we categorize them, are antidepressants, psychotherapy, or maybe combinations of both. There was a recent, this is only published about a month ago, and what we call a network meta-analysis of 100 trials with almost 12,000 patients. So, I mean, I would argue after this that we don't actually need any more randomized trials about psychotherapy or antidepressants because we have enough. But the beauty of this meta-analysis is it tells us not only what's effective, but also what patients prefer, because that's a very important question which often science ignores. So what these researchers found is essentially that there's no difference between psychotherapy and antidepressants. They're both equally effective. Psychotherapy and antidepressants combined are even better than either alone, but that patients in general prefer, they find more acceptable to have psychotherapy than antidepressants, or a combination of psychotherapy and antidepressants versus just antidepressants alone. So I think this is a powerful message for considering what kinds of treatments, if you're suffering from depression, what kind of treatments that clinicians might like to prescribe and to consider. Mindfulness is also very popular at the moment. I'm just showing you this screen to show that you can use Google Scholar to find any plenty of meta-analyses on mindfulness that you want. But I'm not going to tell you much about mindfulness because Dr. Pádraig Dunne is going to talk about this bigger and better than I ever could in the next talk. I do want to touch on exercise. And exercise is an underrated, or physical activity, not just exercise, but underrated treatment for stress, distress, and depression. There's recent meta-analysis of 25 trials which show that exercise had a large and significant effect on depression. So this effect is often effects for treating stress and depression, anxiety are what we call moderate, but exercise is better than a lot of those treatments. And it's not just exercise. You don't have to be a marathon runner. You don't have to be an Olympian. You don't have to be an inter-county footballer. If you just get out and move a little bit more, you'll probably feel a little bit better. And physical activity is a wonder drug because it has a multitude of other benefits also. For example, if we compare physically active versus inactive people, we reduce rates of mortality, we reduce blood pressure, we reduce cholesterol, we reduce type 2 incidence of type 2 diabetes, and so on. I could go on and on and on about. So if you're to remember just one thing about this talk, it's that exercise is a wonder drug and it can probably help you manage your stress. Okay, so you might say it's all very well for me. I'm an academic. I work in RCSI. We have access to a fantastic library. We can access all these research papers and so on. But if I try to access these research papers, I'm asked to pay $50 or they're behind paywalls and so on. Well, that's true, but there are a lot of articles out there which are available for free. And I think these are some of the best ways you can find them. You can use Google Scholar, as I said earlier on. There's another option called PubMed Central. So if you search in PubMed Central, something like stress meta-analysis, for example, any article you find there will be automatically free. That's the nature of PubMed Central. And you can also sign up to a site called ResearchGate if you can't get access to an article. And via that, you can contact the authors and say, would you share your research with me? And most of the time, academics are very happy to share their research. So why not do this? It's free. And also, if you want to critique media health stories, there are two fantastic websites. One has just been launched by iHealthFacts, which allows people to check news stories around COVID, things like wearing masks and so on. Are these worthwhile? And healthnewsreview.org is a more US or international field. But if there's any articles around that you're interested in checking, I'd highly recommend those two websites. Okay, so the last thing I want to touch on is you as an individual. You might say, well, I do something every day to reduce my stress and I find it works for me. Why do I need to go and check science about that? And I would say that you actually don't. If something works for you, just keep doing it. As long as it's not something unhealthy like drinking a bottle of wine every night or something like that. But if you do something that helps you manage your stress and it has no other bad side effects, for want of a better phrase, then by all means keep doing it. And it doesn't matter what the science says. Because what science tells us and what randomized trials tell us is that on average, this treatment will work. And on average, this treatment is the best thing that health services could invest in. But it doesn't tell us what will happen for you as an individual if you try this out. So if you have something that works, keep doing it. If you're unsure, I'd highly recommend talking to a clinician before you try to change anything. And if you want to try something new, why not go to Google Scholar or some other similar site and check out the science underneath or underpinning what it is you want to try out, and then give it a go. So I'd like to wrap it up there by concluding, really. I suppose, shock horror, not everything you hear in the media is necessarily reliable or useful in terms of stress management. If you want to know whether something works or doesn't work, what I would suggest is you look for the words randomized trial or meta-analysis in the news report. And if it doesn't have those words, then maybe I would suggest taking these reports with a pinch of salt. There are lots and lots of effective ways to manage stress and anxiety, and lots of the evidence underpinning this is available for free already. I've talked about exercise, massage, medication, psychotherapy, and so on. But those are what work on average. Remember, if you do something that works for you, please continue to do it. I'm just providing some links here just to finish up. There's a media story here available. I'm not just bashing the media. There is some scientific underpinning to a lot of the stories out there as well. That's just one article. Critiquing media health stories I've already talked about. The Psychological Society of Ireland have provided some excellent resources recently for managing stress during COVID. I'd highly recommend those, and I've already touched on the other articles. And I'm contactable at these addresses. Thanks very much.
Thank you very much for that indeed. That was Dr. Frank Doyle speaking about what does science tell us about the management of the symptoms of stress, anxiety and depression. Coming up now, we have our next speaker, which is Dr. Pádraig Dunn, and he is going to speak about meditation practices for health. Is it all in your head? And other myths.
So hi everybody, thanks very much, Ciara, for that introduction. I'd like to start actually by thanking the events team in RCSI. I think it's been a fantastic series so far. There's going to be multiple more series, hopefully, as we go into the future. And I really think it's been great. I've certainly learned something every time that I've checked into these lectures. So it's been great. So I'd just like to extend a thank you to them. And obviously thank you to Ciara as well for chairing a lot of these recent lectures. So I'm going to talk to you today about meditation generally. And before we get into the nitty-gritty of the bits and bobs of meditation and why I think you should engage it, and hopefully I'll end with a little practice on what meditation is like and how you can do it on a very simple level, I just want to give you a very brief rundown as to why someone like me has got involved with meditation in the first place. And I won't dwell too long on this, but just to give you a little bit of background about me. So when I was 14, I was diagnosed with this progressive disease called ankylosing spondylitis. So for those of you who haven't got this disease, it's progressive joint disease. It affects the joints of the spine and the peripheral joints as well. It can affect the eyes and the gastrointestinal tract and things like that. And it's a chronic inflammatory disease associated with chronic pain. So as you imagine, as a teenager in 14, I wasn't too impressed with this diagnosis. And it really started to impact on me month after month after month during this period of time. And what most people don't tell you when you're diagnosed with something like this, especially when you're 14, is the impact of this kind of thing on your mental health. And really, there was no connection in my mind, in my family's mind, between my mental health and this condition that I was diagnosed with. But over the years, especially throughout my late teen years, I really felt that this disease was having an impact on my mental health. and especially on my emotional regulation. So I was becoming more neurotic. My behavior wasn't great. I had a lot of anger issues. So I could tell that my emotional dysregulation was having a knock-on effect on my symptoms and the pain. So it was creating this kind of negative feedback loop that one was feeding into the other. So I could tell when my symptoms were getting bad that my mental health was going to go downhill as well. And they all went around in a negative, nasty cycle. So as you might imagine, if you have something like this, or rheumatoid arthritis or something like that, you'll do anything to try and quell the daily pain or the inflammation or whatever's going on with you at the time. And I did. I tried a lot of things. The one thing that stood out over decades of trying to deal with this kind of thing was meditation. So I bumped across it in many different types of books that I was reading. Initially, for me, meditation was all about hippies and ashrams in India. It wasn't relevant to me. But as I said, when you engage in something like this, you'll try anything. So I did. And I did it haphazardly at the start. So I dipped in and out, and I probably didn't do it very well. And I was getting bits and bobs from different books and things like that. But one thing I started to notice was that my emotions were more regulated. There was a calm that was coming into me. And the next thing I noticed was that although it didn't suppress the pain, it did seem to turn the dial in terms of its interaction with me. So in other words, it was like a loud TV without the meditation. With the meditation, it was like a small TV in the corner. It didn't switch off completely, but there was a distance between me and it. And then I noticed it could have an impact on my inflammatory markers in my bloods, for example. So this very simple practice that cost nothing except me sitting in a chair was having a huge impact on my physiology, my body, and my mental health. And other people could notice this. So my family would notice this first before I even would. So this got me really interested in this whole area because I was really an experiment N=1 study where I knew that this simple practice, meditation, had a very powerful impact, not just mentally, but physically on me. So that's me as a patient, but I'm also a professional as well. So I'm a research scientist, I'm an immunologist. I worked in research in the UK and Ireland for many years. And then about 10 years ago, I decided to do a strange thing and retrain as a psychotherapist. So I got a degree as a psychotherapist in counseling and psychotherapy part-time. And I became very interested, not just personally, but also in a research context, in the interface between mental health and physical health. And as an immunologist, I'm particularly interested in this and this particular topic here, which is called psychoneuroimmunology. So psychoneuroimmunology is an emerging field, really beginning to gather momentum now, probably in the last 10 or 20 years, now that the technologies are there to really investigate this kind of subject. But suffice it to say that this is a burgeoning area, and it's all about investigating the impact of the social environment, the psychological environment on the body, specifically the immune system and the hormone systems. So that's just me in a nutshell and why I got into meditation in the first place. So I find when I'm dealing with clients and patients in research or in psychotherapy that there are a number of facts and myths around meditation that we need to get through first before we can actually get into the nitty-gritty in the practice itself. And the first one I find is that people believe that it's all about your head. So it's all about controlling thinking, it's all about controlling emotions, it's all about getting a tranquil head, and it has nothing to do with anything else. And the reality is that whatever is good for your head is good for your body. And whatever is good for your body is also good for your head. So the reality about meditation, and I'll go through some of the research out there in a moment, is that meditation practice has a very powerful impact on the body, on a number of different systems, including the hormone system and the immunology system, the immune system and immunity, which is very important right now considering we're all in a pandemic. So it's a bi-directional process that has a physical impact and a mental impact, positive impacts. And probably the most prevalent one, which maybe should have been first here on this list, is I find people think that meditation is about stopping your thinking process. And that's not possible. The only time your thinking process will stop is when you're 6 feet under. So your thinking process will not stop. Your itchy foot will not stop. Your sensations, memories, all of those things that are constantly streaming through your mindscape do not stop. And meditation is not about stopping that thinking. Meditation is about disengaging from thoughts, memories, emotions, and sensations on a moment-by-moment basis. So I would have a lot of people that would come into me and say, oh, you know, I had an absolutely terrible practice yesterday. I was constantly distracted over the 5 minutes or however long I was practicing, and I just couldn't stop thinking. And for me, that's not the point. For me, there's no such thing as a good or bad meditation practice. It's just about sitting in the present moment and dealing with whatever is emerging in the mind at that time. And it's not about stopping thinking or memories, it's about disengaging on a moment-by-moment basis. Another myth that surrounds meditation, I find generally, is that people think that you might have to get a meditation stool or maybe a meditation cushion, or you might have to buy a nice little statue or candles or incense or a meditation blanket. And the reality is that the only thing you need for meditation practice is your head and maybe a chair, but not even that. As long as you have a head, you can engage in meditation practice. In fact, I would encourage people not to go out and buy apps, not to go out and buy books. Don't go on to the websites, just engage in the simple practice, do that for 2 or 3 months, and then come back to books and apps and all those other goodies that are out there. But you certainly do not need any of these paraphernalia. It's all very well and good. If you like candles and you like nice meditation cushions and meditation stool, that's great. I'm not saying don't go and buy it, but you don't need it. All you need is your head. Another myth out there is that you need to be either a Buddhist monk or some kind of other monk to get any benefit from meditation practice. And that's also not true. So we've carried out research over the last couple of years, and so have an awful lot of other groups around the world, showing that with just even 5 minutes meditation practice a day, you can start to see benefits in a psychological and physiological terms. So you don't need to spend hours and hours a day meditating in order for any positive effects to come from it. You can simply start with 2 minutes, maybe gradually adding a minute on every week until you get to maybe 10 minutes twice a day, and you will have and see enormous benefits in terms of your psychology and your physiology. And then finally, I find some people get scared away from meditation because they think it's some kind of religious practice or it's some kind of spiritual practice. And while it is true that the meditation practices are thousands of years old, and they did emerge from Hinduism in India and from Buddhism in India, and then migrated into Taoism in China and lots of other different countries, you don't have to be religious or spiritual to engage in meditation practice. Meditation will have just as much of a positive impact on the atheist as it will the Buddhist. So you don't have to engage in any of these kind of spiritual or religious practices. Meditation is for everybody. So what about the proven benefits of meditation? And we saw an excellent lecture from Dr. Frank Doyle about the importance of looking at sound empirical based evidence. And that's what we need to look at in terms of looking at best practices out there. And that's absolutely true. And Frank mentioned one of these websites in terms of this search engine, and it's called PubMed. And it's freely accessible. And it's one of the search engines that I would use as a professional, as a research scientist. Many people in the healthcare professions and in science would use PubMed regularly. And you can get access to hundreds and hundreds of thousands of different research articles out there. When you go into PubMed.com and you type in the word meditation or mindfulness, you get a number of different results that are popping up. I did this in March. And you can see here that when I typed meditation into PubMed, into the search engine box, what we found is that between 2000 and 2019, that we had approximately 756 articles being produced in 2019, and a huge amount overall in that 20-year period. Interestingly, when you type the word mindfulness into the same search engine, you get almost a 3 times increase in the number of research articles that have been produced in that time period. And we'll go into a bit more detail in the coming slides in the difference between mindfulness and meditation. And there are subtle differences, and I think it's important that we go through them so that you can understand the differences. But suffice it to say, research is booming. There's a huge amount of research being carried out on meditation and on mindfulness meditation. It's not all stellar. They're not all randomized clinical trials. They're not all controlled. So it's important, as Frank said earlier in the previous talk, that you look for controlled trials or controlled research. You can look in systematic reviews. It's not all stellar, as I said, but the evidence is getting more and more almost on a weekly basis. And the conclusion that seems to be arising is that on average, although more work is needed, there seem to be proven benefits for meditation, including mindfulness, for your psychology and for your physiology. So I'm not going to go into, obviously, all the different data that's out there. I'm just going to give you a very brief infographic of what much of the data shows. When I mentioned a benefit here, there is a paper backing this. It would be a controlled trial. So I just want to give you a brief overview rather than going into individual papers here. So we and others have shown that you can improve pro-inflammatory or psychological health in terms of stress, burnout in the workplace, anxiety, and depression in terms of meditation practice on a daily basis for a minimum of 8 weeks. It also improves your sleep. Now, we're not talking it's going to make you sleep 12 hours a day. It improves the quality of your sleep. And we carried out a randomized controlled trial a couple of years ago on emergency department staff in St. James's Hospital in Dublin. And we showed that their quality of sleep was improved and they slept on average for 20 minutes longer a night. And I don't know about you, but I need my sleep and 20 minutes is good for me. In terms of the biology, what's happening in our bodies, so when we're stressed, a stress hormone called cortisol is secreted. Now, it comes out naturally a couple of times a day, but when we're stressed, it's increased in concentration in our bodies, and it has a lot of different impacts on the body. And again, we and others have shown that with an 8-week program of meditation, you can decrease the stress hormone cortisol, as well as other stress hormones. And me as an immunologist, I'm very interested in the immune system and the different components of the immune system. And it's beginning to get clearer and clearer now that meditation has very specific impacts on the immune system on a number of different aspects. So from antibody production to cellular responses and production of chemical messengers called cytokines, which are very important in fighting disease. Improved cardiovascular health. Probably the most studied impact of meditation and mindfulness is on cardiovascular health, and particularly on hypertension, so high blood pressure. And there's a tsunami of cardiovascular events that are issues in the world right now, particularly in the West. And meditation seems to be, along with other conventional approaches, seems to be a very cost-effective way of reducing hypertension. So there's a lot of stuff out there right now on improved cardiovascular health with meditation. As I said, we conducted with colleagues in the Royal College of Physicians, Trinity College and St. James's Hospital a couple of years ago, where we went into St. James's Hospital and we conducted a randomized controlled trial of the emergency department staff. And as you might imagine, staff in this context are very stressed. They suffer from a lot of burnout. We showed at the start that about a third of staff were experiencing psychological burnout. And we went in and we brought in an 8-week meditation program. And I'll describe that in a bit more detail in a couple of slides. But we went in there, 8-week meditation program, and we could reduce burnout, and we improved other things like sleep, as I mentioned. We also improved their immune markers as well. So the bottom line here is that the jury is actually coming in at this stage, that meditation actually has a positive impact on psychology and the physiology, so in other words, the head and the body. The data is emerging almost on a weekly basis. It's not all fantastic. You focus on the controlled trial type of studies, but the research is emerging and it's building, and these are just a number of the different impacts that have been studied, but by and large, they're generally positive. I would really recommend that if you're interested in this area and you want to find evidence about this, so solid evidence from some of the greatest research groups in the world right now who are looking at these areas, I would really recommend that you go online, Scientific American Mind. This is a special issue from 2018. It will cost you $7 or probably €5, whatever that equates to. It is a fantastic summary of all the best research from 2018, which is still very relevant. So that's a very good lay summary. You don't have to get embedded and dogged into the detail and the scientific data, but it's a very good review and summary of all the positive research that's been conducted around the world from 2018. If you want to get into a little bit more detail, and you like more detail and you want to find out about biological systems and about the psychology and the positive impacts in that sense on a deeper level, I would really recommend Current Opinion in Psychology from last year. 60 research articles from groups from all around the world looking at the impact of mindfulness on massive amount of areas, from the psychology, sociology, to the genetics, and to all other aspects like cardiovascular health. So I would really recommend these two publications here if you want to get more detail on this. And I'd also recommend a few books at the very end today as well that you could dip into if you're interested. So this is a very important question for me, and especially with the fact that words like mindfulness really have entered the lexicon of our times now. Mindfulness seems to be synonymous with meditation. It is a meditation, but it's just one type of meditation. And I think it's important that you understand that there are a number of different types of meditations that come from different traditions from all over the world. And this is a superb study. I think if I conducted this study myself, I would actually retire happily. It's a fantastic study done by the Max Planck Social Neuroscience Lab in Berlin, where they looked at 332 individuals aged between 20 and 55, 197 women, 135 men, and this is a controlled study. As Frank mentioned, it's important that these controlled trial studies are done in these areas. And what this German group have found, looking at 3 different types of meditation practices, is that these practices have very different impacts, not only on the brain, but the body and our psychologies. So what are these 3 different types of basic meditation practices? So on the left here, what we have are the mindfulness-based practices. And these practices are based on what's called metacognition or self-awareness. So really it's thinking about thinking. It's observing your internal dialogue, and it's observing the impact of the external environment on your internal dialogue and vice versa. As I said, the biggest example of this metacognition type of meditation is mindfulness. And as I've said there, it's about developing a sense of perspective for the self and the other individual, including the internal and external environments. Now, the other type of meditation, and the one that I'm going to give you an example of before we finish here today, is meditations that focused on developing attention or focus. And an example of that would be mantra meditation. And mantra meditation doesn't have to involve loads of Sanskrit words or loads of Hindu words. It can be something as simple as, I am here now. The bottom line is that you use the mantra to ground you in the present moment. That is the purpose of a mantra, to increase focus, enhance attention. And these type of meditations are very, very good at helping individuals with anxiety particularly, and particularly chronic anxiety, where people might develop memory loss and loss of focus. The third type of meditation is a group of meditations, and they're generally called compassion-based meditation. And examples would be gratitude-based meditation, loving-kindness meditation. These meditations are really, really useful for burnout, particularly for healthcare professionals who have issues with burnout, where compassion might decrease for self, for patients, and for management, for example. These type of practices can be very good at reducing burnout and enhancing compassion again. Again, not just for patients, but for the self. So these are the 3 broad groups of meditation practices that are out there at the moment. And this German group, as I said, looked at these 3 different meditation practices and the impacts of these practices on different systems in the body. So the bottom line from this study was that not all meditation practices do the same thing. So you need to use the right tool for the right job if you're using meditation to try and help you with something. So if you're trying to use, if you've got anxiety related to the current pandemic, for example, you need to use the right type of meditation that will help you with that based on the empirical evidence and research that's out there. So, for example, if you've got an issue with compassion in work due to burnout, let's say you've reduced tolerance for colleagues, you've reduced tolerance for customers or clients or patients, whoever it might be, well then it stands to reason that the meditation practice that you need to engage in for that specific problem is compassion-based meditation. And this will help you with this type of burnout. Now, I just want to show you, and this study, this German group have looked at a lot of different body systems. They've published an awful lot of different research articles looking at different aspects of the body and psychology. I just want to show you one of the papers that they published looking at the brain and the different impacts of these 3 different types of meditation on the brain. Now, I'm not a neuroscientist. I'm assuming that most of you watching this right now aren't neuroscientists. If you are a neuroscientist, I apologize for not going into the detail here, but we're just going to look at colors today with this. So I'm going to show you 3 different colors that are all about the 3 different meditation types. So on the left we have the green color, which is the mindfulness type of meditation. So I will show you what parts of the brain this group have found light up with this type of meditation. Then the yellow one is all about attention and focus-based meditation, and the red one is about compassion-based meditation. So on the top, again, as Frank mentioned in the previous lecture, all good science must have a control in it, minimum. And at the top here, we have a control brain. So this is a group of individuals. They go into an MRI scanner, their brains are scanned, and what we're looking at is a decrease or increase in activity in certain areas of the brain. And what you can see in this particular case is that this group, in fact, on the left hemisphere actually had a decrease in activity in that part of the brain. Overall, the brain was roughly neutral. However, once we look at individuals who've practiced mindfulness-based meditation, again, meditation about enhancing awareness for self and others, what we find is that areas of the brain that are associated with perspective, so the perspective of the self and your inner critic, but also the perspective of others, actually lights up and increases in volume. And this is called neuroplasticity, where the brain can actually change form and neurons can change shape and actually grow. So you can see clearly the green areas here are highlighted in response to this type of meditation practice. Now, if you look at the attention and focus-based meditation practices, the frontal part of our brains are all to do with learning and cognition. And when you practice this type of meditation, that's the area of the brain that lights up. So it stands to reason that the prefrontal cortex, which is the frontal part of the brain, should light up when you're doing these exercises that are training attention and focus. And then finally, as I'm sure you'd expect, if you engage in compassion-based practices, then the central limbic systems of the brain, and that means the part of the brain that's involved in emotional regulation, lights up and increases in volume. So again, you don't have to be a neuroscientist here to see that. You can see clearly that different parts of the brain light up in response to different practices, and it does what it says in the tin. So in other words, if you need to increase focus, well, then the part of the brain that's associated with focus will actually increase in activity and sometimes in volume itself. So that's all very well and good, and I've shown you a bit of a whistle-stop tour around some of the research that's out there. I haven't gone into individual articles. I've talked to you about research in general, and I've spoken to you about the 3 different types of meditation. But I think it's really important that we talk about the nuts and bolts of this practice on a very simple level, and that's what I want to do now in the last few minutes of this talk. So right now, every single one of us have been impacted by a global pandemic, and this is creating anxiety in the majority of people out there, including me and my family and everybody. So this is an important issue. And we can use meditation practice to help stop the development of anxiety and often depression as well in response to something like this. So the goal of meditation, as I said, is not to stop these anxious thoughts. So this is a very simple infographic here where we're looking at COVID-19. It's everywhere, it's in the media, it's in our houses, it's in our neighbours, and we see reflections of it everywhere. And this is going to initiate a cascade of thinking, and it's going to be generally negative types of thoughts that are emerging in the mindscape. And these are like dominoes. Once the first number of thoughts fall over, then we go into a narrative, an explosion of negative thinking, and we can be daydreaming about negative issues for 20 minutes, 30 minutes, sometimes even longer. So the point here is that we want to stop the first dominoes from falling. And those dominoes might be, oh, I wonder, am I going to get COVID-19? I wonder, are my parents going to get it? I wonder, will the country come out of lockdown? All of these different individual things. What we want to do is not to stop this thinking process, because remember, one of the myths about meditation is about stopping thinking. We can't stop thinking, and meditation isn't about stopping the thinking process. What we do is we use meditation to disengage from these thoughts, and I'll show you how we do this in a moment. But the bottom line is this: we try to stop the first dominoes falling in terms of thoughts so that the resultant thoughts don't emerge and these large narratives of negative thinking don't emerge as well, which actually have negative impacts on our psychology and on our bodies as well. So I'm going to focus on what we call attention-based training, which is a focused and attention-based type of meditation practice. If you can remember, it's the yellow one that we highlighted out of the 3. As I said, we've published on this in terms of randomized controlled trials. And I'm going to go through the basic components of how to practice attention-based training. And this is a very simple process. As I've mentioned, we've looked at this with the emergency department in St. James's Hospital. We've also looked at it with chronic disease and other different areas. This is something that when it's done right, it can be very impactful for anybody who does it. And it's quite simple in its essence. And it all begins with usually a hardback chair in a kitchen. So most of us would have probably horrible, uncomfortable chairs in the kitchen that you're not going to sit for hours in, but they're straight backed. And the reason why we want to be upright when we start a meditation practice is because meditation can make us sleepy. And the last thing we need to do is to fall asleep during meditation, because meditation is not relaxation, meditation is work, because we need to train our brains to focus on this type of meditation. So we adopt an upright position, just like the little mannequin here. It's usually a good idea to have your hips above your knees mechanically, because I can promise you, when you start this type of practice, your brain, your mind, your body will do everything to sabotage your practice. You'll have an itchy foot, you'll have an itchy ear, you'll have hunger pangs coming through. So the last thing you need is to be developing aches and pains in your joints. So this is quite a neutral position generally. We're not talking about meditating for 2 hours at a time. We're talking very short at the start, 2 minutes maximum. The bottom line is hips above the knees if you can, on a cushion, upright. You don't have to be rigid, you don't have to have a rigid spine, just generally relaxed, upright position so you don't fall asleep. And this is the most crucial part. So we can't stop thinking, we can't stop memories, we can't stop sensations like the itchy foot. So we need something to hold on to so that these thoughts and sensations and memories don't drag us down the river and lead to those large narratives developing that usually develop anxiety in the long run. So we hold on to one of two things. So you can hold on to the breath, or you can hold on to a mantra. And again, a mantra does not have to be a Hindu phrase or a Buddhist phrase. It could be something simple as, I am here now. And you say it in your mind over and over again. That's your anchor. Or you use the breath. Personally, I prefer to use the breath because that's what I trained on initially. Each time a thought, an emotion, a sensation, or a memory comes into your mindscape, you return to the breath or the anchor. I would recommend, if you want to mess around with this practice, that you play with using the breath or the mantra as an anchor for a couple of days, and then you pick one. Don't flip-flop between the two over a number of weeks. Pick one that suits you the best. No fancy breathing, just normal breathing. Each time you become distracted, you return to the anchor. So the basic cycle of events in this is you set your timer for 2 minutes. That's all. Everybody has 2 minutes. Set your timer for 2 minutes. You've already chosen your anchor. You're in your kitchen chair. You're slightly upright so that you don't fall asleep. Let's say you've chosen your anchors such as the breath. You start your timer, close your eyes, and then you stay in the present moment for that 2 minutes. And you will be bombarded with thoughts such as, what am I going to have for dinner tonight? What will I do tomorrow? Do I have to collect the kids at X amount of time? And deeper things like, how's my career going? And then they might get darker or not. And then you'll get the itchy foot, and then you'll get the itchy shoulder. And each time these things come in to disrupt your mindscape, you return to the anchor. And it doesn't matter if you have to do it 10,000 times in 2 minutes, that's your practice. And each time you disengage, that part of your mind becomes stronger and stronger and stronger, so that over time, your body or your brain falls into a default position where it automatically disengages from the thinking process when you ask it to. And then your timer will go off, and that's your practice done. So in short, get a chair, sit in the chair, set a timer, whether that's on your phone or on a cooker or whatever it is, close your eyes, disengage on a moment-by-moment basis using your anchor, the breath, or a chosen phrase. Then your timer will go off and you're finished. And we recommend 2 minutes, morning and evening. Bookend your day with 2 minutes in the morning and 2 minutes in the evening. Do that for a week, and then maybe add another minute on if you feel like it. Usually, if you can get 10 minutes morning and evening after a few months, I think that's a fantastic practice. Don't beat yourself up if you miss it every other day. That's fine, that's what happens. But 2 minutes is the start. Very simple. Sit, set your timer, close your eyes, disengage on a moment-by-moment basis. Your timer goes off, and then your meditation practice is finished. And it's as simple and as difficult as that. Now, I just want to highlight one other meditation before I finish, and I want to give you an example of it. What I've just described is the core practice. There are a number of other satellite practices that you can engage in, and I'm not going to bore you with all of them today. I'm just going to talk about one. And one of those different types of meditation practices is called the body scan. And I really like the body scan because if, for example, you've had a difficult day at work, or you've encountered a difficult individual, and let's say you're angry or you're frustrated, or you've had a difficult time putting the kids to bed, or whatever it is, or you're upset, it's very hard to just drop into the meditation practice at that point. So you need to do something that you can calm the mind down and you can calm the body down. Now, exercise is one way to do that. Absolutely very good. This is another way to do it. And I find that this is very helpful, not just with me, but with clients and patients, and especially people who have chronic disease issues, that if they can engage in this practice before the main central practice, it helps calm the brain and the body down. So I want to bring you through 2 minutes of this in a minute, but I just want to describe the process. Again, there's no fancy breathing here. There's no fancy position. You don't have to contort your spine or your legs into a lotus position. It's sitting upright on a chair. And then what we do is I will guide you through this. Now you can guide yourself through it anytime you want as well, or there are thousands of free versions of this online at various different lengths with different types of narration. But the bottom line is I will direct you first to the toes of your left foot. To bring your attention into the toes of your left foot, we'll gradually go through your body and we'll end on the top of your head. And we'll do a swift version of it. Ideally, you would do this for 5 to 10 minutes to calm your brain and body down before the central practice. So, as I said, we'll gradually move through the body and we'll end at the top of your head. So, let's practice this now. So again, no fancy posture. Feet on the ground. You can do whatever you want with your hands on your lap or crossed or whatever. You don't have to be rigidly upright. You close your eyes. And you breathe normally. No need for fancy breathing. Sometimes it's good just to get a kink out of your spine or maybe have a little bit of a stretch just to try and relax yourself a tiny bit. And once you're ready then, I want you to follow my guidance. So I want you to bring your attention to the toes of your left foot. Again, continue to breathe normally, just the way you are, that's fine. See if you can get a sense of the individual toes on your left foot. Don't worry about it if you can't. Then bring your attention to the top of your left foot. And then slowly around to the heel and the ankle. And then we move slowly up into the left calf muscle. Each time you bring your attention to a large muscle group, try to consciously relax the muscle. Notice any kinks or pains or tension, and try and gently relax the muscle if you find any. And then we'll slowly move through the left knee. Up through your left thigh muscle. Relax the large muscle groups here. And then from your left thigh muscle into your left hip. Across your pelvis. And down into the toes of your right foot. Try and get a sense as your foot is in your shoe, or if it's in a sock, or if it's bare. Get a sense of your whole foot right now, your whole right foot. And continue to breathe normally. And then we'll move slowly up through the right leg, through the calf muscle, the right knee, the thigh muscle, and the right hip. And we move around to the base of the back. And at the base of the back, we're going to go up very gently either side of the spinal column. And as we move slowly up, consciously relax the muscles again, either side. Until you get to the space between your shoulder blades. And then from the shoulder blades, we move to the muscles of the left shoulder, which are often tense. So just gently relax the muscles here. And from the left shoulder then we move down into the tips of the finger of the left hand. And we get a sense of the whole left hand, the wrist, thumb, back of the hand, the palm of the hand. And then we move slowly up through the forearm, the elbow, the upper left arm. Feel the weight of your arm as it hangs from your shoulder. And then from the left shoulder we move to the right, consciously relaxing the muscle as we move. And again, right down to the fingers of your right hand. Get a sense of your whole right arm now as one unit from the shoulder right down to the tips of your fingers. Feel the weight of it as it hangs. And then we bring our attention back up to the back of the neck. Again, consciously relaxing any tightness. And from the back of the neck, then we move around to the jaw muscles, left and right, which are sometimes tight. So consciously relax these muscles here. Relax your jaw. And we move up either side of your face, past your cheekbones, your temples. Smooth out your forehead. And relax the muscles around your eyes. And then from here we go around to the back of the head, up through the scalp. And notice any sensations at the scalp at the top of your head. And before we finish then, we take one deep breath. And then slowly exhale. And then you can open your eyes. And it's normally at this position that we would enter into the core practice of your 2 minutes meditation. And hopefully you will have felt that this should have calmed your body down and your mind. It might not stop the thinking process because we can't do that, but it will set yourself up for the core practice itself, which can only be 2 minutes. So that's the end of that. Thanks very much for watching. And I would recommend these books. I think if you're interested in the science behind meditation and different types of meditation practice, these are very interesting books. You don't need to be a neuroscientist to read any of them. And you might be familiar with Jon Kabat-Zinn. If you're particularly interested in mindfulness, that's probably the Bible in that area. But all these books are very good, and they give you an idea of the science that's emerging behind these practices. So thank you very much.
Wow, thank you very much for that indeed. That was, of course, Dr. Pádraig Dunne. I don't know how you feel, but I feel like a changed woman. Extraordinary. I have to say it to Pádraig that physically I changed, my feeling and my affect changed over that very short period of time. And I've no doubt that those listening to the lecture this evening, if they did all of that, will have changed too. That brings to a close tonight's lecture. I hope it was as useful to you as it certainly was to me. These are, as we have said, extraordinary times, and I think dealing with stress management, even though we planned to do this long in advance of the pandemic, has been an excellent subject matter for tonight's Positive Health, My Health lecture here at the Royal College of Surgeons in Ireland. My sincere thanks to those who took part, to Professor Ciarán Ó Boyle, to Dr. Frank Doyle, and to Dr. Pádraig Dunne. I hope you've enjoyed it as much as I have, and I'm going to hand over now to Professor Ciarán Ó Boyle, who will talk to you about what the RCSI has coming up for you going forward.
So that concludes the My Health series for 2020. Keep an eye out on our website and on our social media for the next instalments of these RCSI lectures. The new series, the 2021 series, will launch soon. We will also soon be launching officially the new Centre for Positive Psychology and Health, so keep an eye out for that also. It's part of the mission of the RCSI to seek to improve the health and well-being of as many people as we possibly can. It falls for me to just thank again this evening for our speakers, Dr. Padraig Dunn, Dr. Frank Doyle, and for again our excellent chairperson, Dr. Ciara Kelly, who brings so much to this in terms of her understanding of what's happening in healthcare in Ireland, her background as a doctor herself, and we wish her well in her new role in News Talk. I also want to particularly thank the events and communications teams here in the RCSI for what has been an outstanding series of lectures during the course of the year. And of course, in these times we live in, we wouldn't be able to present this to you virtually without Nuala and Kieran and Philip, the crew here tonight and on previous nights. So thank you everybody who's been involved in this series.